All right, ready to dive into the world of chest wall deformities.
Let's do it.
We've got some fascinating medical excerpts here. Chest wall deformities and surgery for pectus deformities. Really gets you thinking about how these conditions, actually impact people's lives.
And what's so interesting is we're not just talking about appearances. These conditions, they can be totally benign or in, well, some rare cases, actually life-threatening.
Yeah, it really is more than skin deep, isn't it? The sources really highlight that these deformities, people don't always talk about them, but they can really impact someone's health, their well-being, the whole picture.
Absolutely. And one of the most common conditions we see is pectus excavatum.
Okay, so for those of us who, haven't been to medical school, what exactly is pectus excavatum?
So pectus excavatum, or PE, it's often called, you might have heard it called funnel chest. And that's because of how it looks. Like imagine a depression in the chest, and you can really see it around the lower part of the breastbone. And it's more common than you might think. It affects about 1 in every, say, 200 to 1,000 births.
Wow. See, I had no idea it was that prevalent. Now, the sources mentioned something called the Haller Index. What can you tell me about that?
Yeah, so the Haller Index, it's basically like this key measurement that doctors use. They use it to assess how severe the pectus excavatum is. So they'll take these measurements from a chest x-ray or like a CT scan, and they use those measurements to figure out this ratio, right? It's the ratio of the chest's width to the distance, between the spine and the back of the sternum.
Okay, so if I'm visualizing this right, it's kind of like, are we talking about the slope of a roof?
Yeah.
A steeper roof, more severe?
You got it, exactly. That's a great way to think about it.
Okay, so a higher Haller Index would then mean a more serious case.
Exactly. So a normal Haller Index, you're looking at around 2.5 or even less. But then someone with PE, it's often between 3.5 and 5. And sometimes, in some really severe situations, it can go as high as 12.
Mm-hmm.
And, at that point, it can have a real impact on the heart and the lungs, how they function.
Wow. That's a big difference. The articles mention that even a score of 3.2 is already considered severe. So even what might look like, from the outside, a mild case could actually be pretty significant medically.
That's a really important point to make, yeah. And it kind of leads us to the question of what it's actually like, for someone living with pectus excavatum.
Right, because it's not just about how the chest, physically appears. Mm-hmm. It's about what that actually means for a person's life, like day to day. What sort of symptoms might someone with PE experience?
Well, it really, it does vary from person to person. Some people might just experience some mild discomfort, maybe a little short of breath if they're exercising, or some chest pain every now and then. But for other people, in more severe cases, it can be a real struggle. Fatigue, they might have chest pain that keeps coming back, maybe even have trouble keeping up physically with their peers.
Yeah, that makes sense. It sounds like you have to imagine there's a psychological component too, right?
Right.
Especially for kids and teenagers.
Oh, absolutely. Put yourself in their shoes. You're a teenager, maybe already a little self-conscious like most teenagers are. And on top of that, you've got this visible chest wall deformity. The research really, it emphasizes the emotional toll that this can take. Social anxiety, maybe they don't want to do certain activities like swimming. Maybe they even have body image issues, self-esteem, that kind of thing.
It's heartbreaking, honestly. And I think there's often this misconception that pectus excavatum is, kind of a cosmetic concern. But based on what I'm reading here, it seems like there's so much more to it than that.
Yeah, the research it's pretty clear. Pectus excavatum can have consequences for your health long term. There is this one study that found people with PE, untreated PE, had a 20% shorter lifespan compared to people without the condition.
Wow. I had no idea it could be that serious. What contributes to these health risks, it seems like? Counterintuitive,
Right. But it's really about the shape of the chest and how that shape can actually physically constrict the heart and lungs. And there have been studies, they show that people with PE, a lot of times they have what's called a restrictive lung function pattern, meaning their breathing capacity, literally how much they can breathe. It's restricted by their chest wall.
Wow. Okay, so it's not just about the outward appearance. It's really about, how well the body can function, which I guess that makes the whole treatment aspect even more critical.
Yeah.
And speaking of treatment, I want to make sure we talk about the surgical interventions that, have been developed over the years, starting with maybe the earliest approaches historically.
Yeah, well, surgical approaches, if you think back to the early 20th century, it's come a long way. Back then it was It was a lot more invasive. I think a real turning point was in the mid-20th century with this surgeon, Mark Ravitch. He developed this procedure, and it was all about reshaping the chest. So surgically, they would remove portions of the affected cartilage, make these cuts in the sternum, and then fix it, but fix it in a more outward position.
That sounds pretty intense.
It was a big surgery, no doubt. And while it was effective, it worked, you also have a longer recovery time to deal with and more noticeable scarring. Even today, with all the advancements we've made, if you're doing an open surgery, they still draw upon those principles from that Ravitch procedure. Although, of course, it's been modified over the years, trying to make it less invasive.
Mm-hmm.
So these days, they really focus on preserving as much of what's called the perichondrium as possible.
The perichondrium, and remind me,
It's that membrane that surrounds the cartilage.
Oh, right.
And that's super important, that membrane, because it's crucial for the cartilage to grow, to develop the right way. So if you can preserve that, you're going to get better results long term.
That makes a lot of sense. Now, I want to shift gears a little bit here and talk about, this is a really kind of groundbreaking development in the field, and that's the Nuss procedure.
Ugh. The Nuss procedure. Yeah, that was a game changer. Minimally invasive, When it was first introduced, I think late 1990s, it revolutionized how we treat PE. And the biggest difference is instead of taking out the cartilage, the Nuss procedure, it's all about reshaping it. And they do that using this curved metal bar.
Okay, so how does that work?
So what they do is they make these small incisions on the sides of the chest, and they insert this curved metal bar, right? And it goes behind the sternum. And that bar, it basically acts as a lever. It gradually just reshapes the chest wall over time.
So it's almost like braces for your teeth, but for your chest.
Exactly. That's a great analogy.
I like it. And how long does that typically stay in place?
It can vary a bit, but usually you're looking at a few years. It needs time, that cartilage, to actually remodel itself. Younger patients, sometimes it's a bit longer than older patients.
Okay. And I imagine, this Nuss procedure, it sounds a lot less invasive than the open techniques that we were talking about earlier.
Yeah, it is. Definitely. Less pain, much faster recovery, and smaller scars, So yeah, it's been a game changer, especially for younger patients and those with deformities that are more symmetrical. But, and I do want to say this, like any surgery, it does have potential risks. Things like a pneumothorax.
A pneumothorax. And break that down for me. What is that exactly?
So pneumothorax, that's when air leaks into the space between the lung and the chest wall. It's a risk with any chest surgery. But the good news is, it can usually be managed. It's treatable.
So given, there are risks with both approaches, benefits to both approaches. How do doctors decide, okay, this is the surgical option that we should go with for this particular patient?
Yeah, that's a good question. It's really like a multifaceted decision. It's not just one thing. Doctors are considering so many factors, how severe is the deformity, how old's the patient, what's their overall health like, what are their personal preferences. And they also have to look at whether the patient has any other conditions. Like the research pointed out that scoliosis, that's actually pretty common in people with PE.
So it really is about personalized medicine, right? Like figuring out the right approach for that individual.
100%, yeah.
Okay. So we've talked a lot about pectus excavatum, but I want to make sure we have time to touch on another type of chest wall deformity, and that's pectus carinatum. What can you tell us about that?
Pectus carinatum, yeah, that's also known as pigeon chest, and you're right to bring it up. It's less common than PE, and instead of a depression like we see with PE, this one, it's an outward protrusion of the sternum and ribs, kind of like if you imagine the keel of a ship.
Ah, okay, that's where that name comes from then, carinatum. I was wondering.
Exactly, and it seems to present a bit later than PE, usually during puberty. Now, it is less common, but that being said, it can still have a real impact on someone's life.
And what about symptoms? Are we talking about similar things to pectus excavatum?
There are definitely some similarities, yeah. So with pectus carinatum, you might also see chest pain, breathing difficulties, and then, of course, that psychological distress that we talked about earlier. That's a big part of it, too.
Right. So how is it treated? Are we talking similar treatments to PE?
There are surgical options and there are non-surgical options available. And one thing that's really interesting is that external bracing that's become more and more popular, especially for adolescents.
Bracing for the chest. Okay, we'll delve into those treatment options a little bit later. But before we get ahead of ourselves, I want to touch on some of the rarer forms of chest wall deformities, because I think a lot of people, they're not as familiar with those. So what can you tell us about some of those rarer chest wall deformities? Now, that's something you don't hear every day. What kind of conditions fall into this category?
Well, one example is Poland syndrome. It's pretty fascinating.
I've heard the name, but I have to admit,